so many of you with us this morning, many familiar faces and many new. So yeah, massive welcome. This is really just an overview of what we mean by the term community-led support. It has grown as a programme massively over the core essence of it, the principles, the values have not changed. National work areas who are doing this work on the ground, and over the course of the next 2 days you'll be hearing some of the ways in which it is growing as a concept. That's how we'll be covering the next 2 days, and this is, as I say, this is really just a bit of an overview, but I want to talk very briefly about us as a programme and the network, because we get, you know, that's different to community-led support as a concept. I'm also going to pop in two short videos which came on the back of the National Institute for Health and Care Research funded work that went on over the last 3 years actually, and the report was published last year. Colleagues will be talking more about that tomorrow morning, and actually what the new areas that they'll be taking that research in terms of our community spaces. But from the work that has happened today, we or NIHR commissioned 4 videos. They will be on our website, all of them very shortly, and we're wanting to share them publicly during our festival, so no more than 2 to 3 minutes each, but it kind of brings to life some of the ideas that we're talking about, the first being on changing systems, and I'll finish at the end with leadership and culture. And also, of course, after I've described community-led support as a concept, I want to just touch fairly briefly, on impact, the difference that it is making, and that will be picked up again in a lot more detail in Mike's session on demonstrating impact and evidence this afternoon. So that's how I'm looking to spend the next hour or less with you. We will be finished by 10:30, but I would like some time, if there is any questions or discussion, any comments, observations. Hopefully we will get time for that just before we finish this morning. So as Amanda said, do pop any questions or comments in the chat, and I'm very happy to be interrupted as I go along. I always think on these presentations that my voice must get very boring, but so off we go. So a little bit then first about the national network. As I say, we've been going now for over 10 years. It's very much a network of learning, sharing, mutual peer support. In the old days, pre-COVID, we brought people together in person. Now, primarily it's online, but we do, I'm really pleased to say, we do still have a large national event where we do a residential, and we have 80 to 100 people from across the network coming together for that really rich sharing, learning and connection. It's a wonderful, vibrant network. It is I think it's the engine of CLS. It's the heart of it. It's where in the ground, and it's the program has developed and been over the years. It's by you lot out there doing it, you know, and sharing, and then the program grows, and others are inspired and develop more in their own areas. I'll be talking tomorrow afternoon, just as an aside, about how the program is still developing across whole community areas. So the network is that forum for sharing and inspiration and mutual problem solving and connection. So just a bit about that if we talk about the network. And as you can see, as really broad, from very north Outer Hebrides, Shetland, Orkney, right down to the south coast, very range of environments, very rural to inner city, and we're still working in Wales as well. with Denbighshire. So a real wide variety of areas. The event are fun. They're enjoyable. They are very much active, as I've said. That was just some images from last November. So before I get into what is CLS's concept, I'm going to talk about the well, I'm not going to talk about. I'm going to share a short video with you about changing systems, because than I could by words, I think, and then we'll get into what we mean by community-led support. So I'm hoping this works. I'm hoping you have volume. Check it's on, and yeah, just 2 to 3 minutes. Bit of uplifting music on Thursday morning, that's what we all need, isn't it? I think you'll agree that that video says it so well, and hopefully captures the challenge as well as the joy of working in this way. So community-led support is about transformational change, system change, its process, and fundamentally it is about putting people at the heart of the way that support of whatever service or support they come into contact with. There is no blueprint. This isn't about saying this is how it works and we'll parachute it in. It's not like that at all. It is very much shaped by each local area, because fundamentally every community is unique, has unique resources, demands, pressures and opportunities. So it's very much tailored by local people who know that area, practitioners, clinicians, officers, partners, people who really know that community. And we always say this isn't rocket science. Working in this way is everything we know we should be doing. And it's many decades now that I've worked in adult social care. We've known that we should be doing these things for many, many years. There's nothing radically new. That what is different about community-led support, I think, is just we do it. We support the areas we work with to really, really do the right thing and to do it in a really concerted way. So it's that real focus on doing what we know is best practice, is what people want and what we would want from any system, if and when we are needing to draw on it and rely on it. This slide for me just sums up where a lot of I think people who work in our sector are at the moment. Very, very busy. There is no shortage of commitment. It's so humbling and reassuring to hear the commitment, the dedication that is out there. But people are, I think, not always having the time, the opportunity to work in a way that really connects with their sense of purpose, I suppose, to really make a difference for people. So many people very committed, very busy, putting in long hours. Is that resource, is that input really having the most effective outcome? I think the answer is often no, because we are to coin Amanda here, she always says that we're doing the wrong busy. It's not busyness that serves the purpose. So we in NDTI aim to give teams, practitioner services, with partners, with people, space to think differently and to ask, how could we do this better? How could we achieve what we are here to do in a better, more efficient, more effective way? And the answers are always there in the room. People know what needs to be done. It is just about unlocking that capacity, that space, but very importantly, having permission to work differently. And the leadership, as I touched on, and we will have the final video about leadership. The leadership is key to provide that space and to give permission to all of those people, partners and staff to be creative, to work differently, to reduce bureaucracy, to redesign systems. I think that is the key, and once that is unlocked, we find there is no shortage of ideas and enthusiasm to adopt and really drive very different, creative, new approaches. So we talk about the engine, the competency. CLS is a bit of an engine, and any of you out there will probably be thinking that those cogs wouldn't actually all turn. If one turned, the others wouldn't turn. But I'll come to that later. There are lots of little mini cogs as well. Essentially, we're looking at it's so big that you've just got to start somewhere. And many areas will start in the green cog at the top. They'll look at their internal strength-based approaches for people who are already known to services, to ensure they have good outcomes, good support tailored to them, that reviews are strength-based, all of those things. Getting that right is key. Other areas start at community level. It's saying let's just ensure people don't need to come anywhere near our services if they can thrive, get the information, the support that they need within their communities, touching on a whole range of community partners, getting support advice when and how they need it, and having that first conversation in a really friendly, informal and welcoming venue, which means that they don't have to, wait and risk crises developing. So that really strengthening what happens in our communities and making it easy for people to self-manage or to get that early support when they need it is key. And of course, if we're going to do both those things right, we've got to get the commissioning right, and we've got to work with providers. We've got to ensure commissioners are supporting those community supports to do what they need to do really well. It's a rich system, and any one bit will impact on the other, and the challenge is we have to do all of that. We have to get all of that right, but as we say, you've got to start somewhere. It doesn't matter which cog you start in, you've just got to start, and when you start that dedicated work, you will find that it has a positive impact on the other bits. I think we're saying with the cogs analogy is, if you work in a good way, or it could be in a negative way if it doesn't come off. But the focus work through CLS means that the good practice really drives change in a systematic way. We look at learning as we go through the balanced evidence. We co-produce. I'll talk more about that in a few moments. We'll talk about the principles. Likewise, this is all about collaboration, great leadership, as I've mentioned. Those welcoming community spaces seem to be a really key component of community-led support, and there will be a whole session on that tomorrow morning. And the good conversations at the heart of community-led support, putting people at the heart of their support, as I say, and listening. And around the edge are our CLS principles. We'll talk more about those, but it's a complex and multifaceted engine of cogs, but if you can just start somewhere, you find that positive change really impacts well on other areas of the system. It's all integrated, and alongside our principles, which I'll come to, three in support. You will have heard these terms. Don't break law. Work within the confines of our legal system. But do you know what? When you look at across Wales, Scotland, and what the statute promotes, so don't break the law. Don't break the bank. Let's not spend any more money than we are currently spending. Let's not focus too much on the money, but as Mike will demonstrate later, we have lots of evidence that says now, if you do the right thing, it will save money in the short and the long term, and do no harm. And those are the three rules. Do right for people, and then we say, but do break the mold. Be creative, be challenging. We can't just tinker at the edges of our systems any longer. We've got to do something pretty radical, but doing it in a collaborative, thoughtful way that puts people's work is good. Always comes out. It's disheartening to know, isn't it? So the principles, you've got to do all of them. They are a compass for our actions, our decisions, our behaviours, and the challenge, I suppose, is sticking to those principles throughout when times are hard, when there's a lot of pressure on services. And as we walk along the areas we support, I guess we support that the sticking to the principles throughout, and ensuring that they can really come to the fore to ensure best outcomes for people. So we co-produce. I mean, it's such a given, isn't it, that let's not change anything without listening to, without hearing the experiences of people who for whom their lives are directly impacted by this change, but also the collaborative nature of that. Let's listen to, and let's all of our partners. On this slide, there are many more. This is a community effort, and it is about bringing together voices and experiences, and hearing and connecting people who, come on to the next slide, who within that place all have a shared purpose, a shared ambition to improve the lives of people who live in that community. That. No one can do that in isolation. No one organisation can or should. This is about bringing people together, sharing our limited resources. But actually, when we think about resources being knowledge of the community, it might be volunteers, it might be the people who work for those organisations, collaborating and working together better. It might be the spaces, it might be the knowledge of that community and the trust within that community. All of that, when we pull that and work together to look at the whole picture, we can do a lot with all that. And of course, the whole is greater than the sum of the parts. It is that really focus working within communities that seems to be so effective. And yes, then they develop community spaces. They can really design different ways of working together, but we have to take a place-based focus and look at the whole person, so that people haven't got to go round the houses to address different needs. Let's look holistically. So bringing people together around place is a really important aspect of this. Putting people at the heart. I've said this already. Strength-based, person-centered practice. It gets called many things, and I know that many services and people have been doing this for many years, but this is about ensuring that the system, the environment in which people work, really encourages people's strengths and talents and gifts to be at the fore, to be recognised and to be built on, strengthening independence, investing in their independence, and really being mindful of their control they have over their life and their community connections. That is at the heart. The good conversations, the listening, is a very large part of this, but will really have maximum benefit. Is where the system around those practitioners, those individuals having those conversations, really strengthen the approach. And it's a given, really, but let's try and avoid crises. Certainly, you know, I've worked in this field for many years, and for decades we've been saying, if only we could have spoken to that family sooner, if only we could have given them that information a year ago, they wouldn't be in this situation now. Let's avoid the trauma that people unnecessarily sometimes experience through a situation growing and really negatively impacting their life, when an alternative could have been, you know, in place if they had been able to reach out to someone sooner. So this is about people not waiting. It's about support being available where, when, how people need it. And we talk about the right conversation at the right time, in the right way, but really let's avoid that waiting, which is one of the bugbears of our current system in so many places. I touched on bureaucracy earlier, but when we talk about capacity in the system, there is very little capacity in the system right now, but the only way we can find new capacity, because there's very little new funding coming in, let's be honest, it's about saying, what are people doing? How are they spending their time? Because if a social care practitioner, for example, is spending more than or even 4 days a week servicing the system, doing bureaucracy, administration and process, then we've got something wrong. So what we do is we try and turn it on its head, so that bureaucracy is the minimum it needs to be, so that they are spending most of their working week doing the work they came into the profession to do, which is connecting with people, having those conversations, finding solutions, working alongside people through difficult times, and supporting good outcomes. That's the difference people make. And we really have to be quite ruthless in terms of questioning every bit of recording, bureaucracy, and monitoring and scrutiny that people are subject to within that. And the good news is that working within the law, as I mentioned earlier, there is it is absolutely possible to reduce it right down. And I would say very strongly, less is more in terms of recording. But and it is very much about the culture in which people are working. There's all sorts of cultures that drive a feeling of a need to record a lot of information, sometimes unnecessarily, sometimes even more than the system is requiring. But so we've got to really address the sense of whether people feel, just to segue into my next principle, do people feel trusted? Do they feel empowered to make the right decision? Is there psychological safety within teams? Is there a fear of getting it wrong? How do we regard risk? What happens if a plan doesn't come off? You know, is it a blame culture? All of that will impact on the extent to which we feel able and willing to record less and have those brave conversations with people, sometimes around risk, around around working differently, and different solutions for people. The culture is so fundamental here, and it's not just within our organizations, it is across, really importantly, across all is one of our really, for example, to reduce the to have got away, gone of internal and cross way together. They have agreed how they will connect with each other. Some of us, so there is that trust and that shared approach within and across organisations. So it is possible, but as I say, it's not easy, and to them working very differently. All focused on great outcomes for people, of course, and we can do that if we are proportionate. So one size will not ever fit all, because people are complex and different and wonderful, and everyone is unique. So the skill is knowing the right response for the right situation, and not being constrained to work in a pre-programmed way with individuals. We have to be responsive, as I say, not waiting, not making people be passed from pillar to post, and not waiting. And if we are proportionate, if somebody can have their issue addressed easily through a 10-minute conversation in a local library or community centre, then that's great. And there might be a short record of it, a note on the system, but there might not be. And other people will need an in-depth, more full assessment and home visits. We're releasing capacity to spend it where it is needed, to spend time where it is needed. But yeah, proportionality is key here. And again, it's the leadership, it's the system that enables that way of working to not only be permitted, but to actually be encouraged, and to be the way that our organisations work. This is a very high level, very simplistic, but I think helpful description of how the areas in the CLS network that have found the real successes out of working in this way, their model, very high level, seems always to follow this pattern. There are spaces in the community that are welcome, open for people just to call in at certain times of the week, sometimes on appointment, but places people can go without waiting too long, which avoids people unnecessarily having to go through our customer services, or to be routed through GPs or hospitals, or our school system. But if people can have those conversations when they need it, as I say, that seems to be key. That for people whose need is addressed at customer service point, and those might be integrated single points of access, whatever they get called, a really good conversation, or a listening conversation that seeks to resolve it and find solutions also is absolutely key. And if they can't resolve it on the telephone, then they would invite somebody to call into their local venue to have that more in-depth face-to-face. And for people who really do need that more intensive, more that home visit, perhaps, for whom it really is looking like they need a full assessment, then that capacity is freed up, because only the people that need that are having that home visit. So we're using our finite resource of professional time much more wisely where it is most needed. decisions around planning, if somebody does need paid support and they have a conversation in a community space, then that shouldn't have to go through panels and lots of process to get funding. There should be delegated decision making around what can be put in place swiftly, easily, without having to go through that system, as I say. And then that follow up and check back, it might be a statutory review, it might be a phone call from anybody, it might come through customer services. In some areas it's even volunteers or third sector. But that, how are you getting on? How is it going? You contacted someone, you had a conversation. I see some things were put in place. How is it going for you now? Unless we do that, then we're not knowing whether what we are advising people is actually working. And going back to the statutory reviews, having those in a community venue where there's lots of partners with local sports, knit and natter, the walking football, people connect with opportunities they didn't previously know existed. So lots in there, but in essence it's about an efficient system that uses our resources as to best effect, so that people can get the best experience when they are reaching out. So you may not be able to read everything on this slide, but it's just an attempt to say the networks that I talked about that work at a community level, a neighbourhood level, are there's no limit on them. They're likely to involve your social care officers in some shape or form, housing, mental health, maybe community partners like food banks, but absolutely what's going on in that community, volunteering opportunities, maybe digital, maybe some information that. It is whatever people are presenting with, what they needed, and what is available locally. Some great examples now of primary health really getting on board, community health therapists getting involved in those local venues as well, to really provide that holistic health and social care suite of support around people when they are in those venues. So loads there, and as I say, much more to be discussed about those community venues tomorrow morning. Pausing to draw breath. So before I finish, just want to touch briefly on the so what difference is this making? And there was some research done, as I mentioned earlier, funded by the National Institute of Healthcare Research, published last year, and it was great to have an independent perspective from many conversations of people in the network, partners and people who have used and are using the supports, as well as staff and partners. So great to see a kind of independent analysis in terms of the seeing that cultural change, that learning and peer support through those networks, that positivity and openness that we encourage. And just to quote the report, just in terms of the, does it cost any more to work in a really person-centered, community-focused way? It was great to have this independent, very thorough analysis of the data that said, quantitatively, if we're looking at it, the areas who are doing CLS correlated with other local authorities are seeing a reduction in the levels of people who require funded care and provision, and interestingly that is maintained over time. And no indications of increased expenditure, so suggesting improvements were achieved within the same resource envelope. I think so often the economic resource that is released through this, the savings, but it is tied to do the right thing, as I've said. So it's complex when we're asking this question: does it work? Absolutely, this research was so helpful for us in saying yes, it does work, and we can compare the areas doing community-led support to those who are not, to see some real benefits, even when demand on our services is still growing. So it's a real vote of confidence if we are interested in the economic value of this. I want to just share a few slides which are some examples from across the community-led support network from recent years. We published these in a report called The Economic Value of Community-Led Support. I think that was the title, which is on our website in February 23. So just a selection of findings, if you like, from across the network, which, because we're in the climate we are, you know, we have to look at the economic impact of working differently. I understand where focus is at the moment, but I hope that through these examples we will really demonstrate doing the right thing actually works for organisations as well in terms of their economic impact, as well as doing the right thing for people and that qualitative impact, which I think there's more research done on that. With waffling now, reduced reliance on formal services. That is that is so much better, not just for services, of course, but that's better for people. People do not want to be reliant on our statutory services. Fewer crises, that's music to our ears, and increased use of our voluntary sector options. Now, if you're listening to this working for a voluntary sector organisation, you may be thinking, oh, yeah, but that just puts pressure on us. This is where the commissioning cog has to come into play, because there may need to be resources moved around to address, you know, where people are drawing on support in a different way of working. So we've certainly worked with the local authorities that have done that, and through those callbacks, they have realised that people are now drawing on that's maybe an individual community service that has got its own waiting list now. So it needs, you know, it needs resources going into it. So 5% in reduction in one area in the use of formal care compared to expected levels, so compared to previous years. Reduce waiting times, that's also really important. Fewer people, but waiting for less periods for that initial contact. So in many areas, there's some wonderful statistics about this that are being shared now, getting that right down to just a few days, really whenever they can next get to a community venue. But really, we should be talking about days in terms of waiting, not weeks. And higher take up of those community-based support options. Again, fewer crisis responses. Again, this was a different local authority. And we know that one of the indicators of that is the unplanned reviews. Again, Mike will talk more about this, but crisis response triggers an unplanned review, and we can see you know, what is happening with that data point. So fewer unplanned reviews. Reduced reliance on formal services. Sorry, I've same slide again. Fewer formal assessments. Go back to the right slide. And this is an interesting one, an area that looked at this in more depth. People were offered a good conversation earlier instead of going on a waiting list. So to be clear, these were people who would have gone on the waiting list. 42% of those who took up that community-based option no longer wanted or needed the involvement of formal services. And then they went back and checked that people had had their issue addressed. So, you know, 95% of people were satisfied with the outcome of their conversation. So you've got to do that rounded suite of, did we get it right? Not just, you know, we bounced people away. It's not about that. It's about a better support for people. Really great to see as well indicators now of reduced use of formal care over time. So people not only avoiding the need for formal care, but not needing to come back and draw on it in a short period, but staying independent, staying well. And again, we can measure that through wellbeing outcomes and other ways that I know Mike will be talking about. Staff are spending their time, better use of time through proportionate responses. I've mentioned this already, but you know, even just doing a full assessment is a resource that takes time. 5 to 7 hours, and we can work out what that actually costs, and it's a lot of money. So fewer assessments are better, not only for our organisations and our busy social work teams, but as long as the person is getting a good outcome, we don't need to always take them through that assessment. So this is the proportionality, and obviously because there's fewer, they're waiting less time for that. A really great indicator as well in a number of areas is that improved staff morale. We can measure that through surveys, but less sickness and less turnover, so higher staff retention is a common indicator. Much more engagement, feeling valued, feeling trusted, feeling that their voice counts, and feeling that their experience and expertise is valued and has a purpose. So I interpret that by saying people are reconnected with their sense of purpose and why they came into the profession, and that's across our I'm not just talking about social workers, that's across practitioners and community staff as well. So that connecting people with why they came into the role is great, not just for people, but obviously for the staff involved as well. Fewer complaints is always good, isn't it? I don't want to measure success by a lack of complaints, but it is an indicator, and it's an important one. And I know, but we haven't got it mentioned here, that also people are seeing many more compliments as well. And you've got to be brave sometimes to ask for that feedback, but when the areas we work with do, they are getting some great feedback, and that's telling us that this is working in a really qualitative way for people as well. Increased use of short-term services, so for people using hospitals. So we've been doing some really focused work in a number of areas with the whole hospital readmission, sorry, not readmission, discharge process, avoiding readmission, and seeing that actually when we get that right, people will stay well for longer, but also that network of community support that is holistic and there when people need it, helps them stay well longer and helps them reconnect with their community. So we're seeing fewer people needing to be readmitted to hospital within those 3 months. So great outcomes for people who have enter adult social care, if you like, as a result of a hospital admission. I'm going to draw breath now again and show you a short video, and then hopefully we can have some questions and discussion in the time we've got left. So let's hope this works. Thank you. And this one really focused on the leadership and the culture, which we've already been talking about so far. So. There we go. Let those credits roll. So I hope you found that useful. I hope it was informative for you if you're new to community-led support, or a good refresh for those of you who've been working alongside us for a